Hey, Smart Chiropractors, welcome to the Smart Chiropractor Show and our featured guest segment. On today's episode, we have a friend and business partner, I should say, of myself and somebody Jason's known for quite a while as well, Nick Lancaster of AOMSI Diagnostics. We're going to be discussing everything around functional spinal imaging. I want to give full disclosure. I am involved in AOMSI Diagnostics, and I wanted to use this as an opportunity to really showcase what we're up to and have Nick on to discuss what I think is one of the most exciting opportunities within imaging. We'll get to all that and more. Nick, thanks for coming on and chatting with us today.
Yeah, absolutely. Happy to be here. Thanks for having me.
Our pleasure. I want to kick it off right at the top. For anybody who's not familiar, when I say the words functional spinal imaging or AOMSI Diagnostics, what are we up to? What does this mean? Is it an X-ray, an MRI? How would you define it?
When we're talking about functional spinal imaging, we're talking about specifically vertebral motion analysis. We abbreviate that as VMA, not the Video Music Awards, but seeing that spine in motion, right? And so we talk about, the X-ray is great, the MRI is great for identifying those particular challenges while a patient is still, right, and not moving. But what happens when that patient is moving, right? When they fully bend, when they fully flex forward and fully flex backward, as we all know, we don't live our lives just sitting and standing in static motion. So what we do with AOMSI Diagnostics and some of the functional spinal imaging is we start to evaluate what happens when a patient does flex forward and flex backward. So that's where we have the vertebral motion analysis that allows us to gather all of that data in between those movements and really plug in that data for practitioners so that they have the best information to make the best treatment decision for patients.
I'm fascinated by it. Obviously, I think every chiropractor knows the importance of vertebral motion. But is this a technology that chiropractors should be using sort of day to day in their practice, or is it specific for, documenting cases of some kind, or how should practicing chiropractors think about this technology?
Yeah, it's a great question, Jason. And we have practitioners that will use it really on a case-by-case basis, right? And so a lot of our practitioners will utilize this, a lot of times to supplement their flexion extension X-ray. A lot of providers, depending on the provider type, right, might take a flexion extension on every patient. So we have providers that will do that. And if they see any type of instability and any unstable challenge that might be there, they'll order a VMA at that time. For those providers that may not have X-ray in-house, or they, choose to utilize the VMA for every flexion extension film, we have those as well. So it really varies. It depends on the practitioner, how they like to practice. The data is really invaluable. And what we talk about from the instability side is really functional spinal stenosis and some of that clinically significant instability, right? We all know that if somebody's unstable and they're to the point where they might need hopefully they never do, but they might need a surgical intervention, that's one side of the equation that really we don't necessarily touch all that often. But what we do talk about quite a bit is that functional motion, right? The motion that's occurring that is abnormal, what we call clinically significant, that's causing some of those challenges. And so, it really varies on how those practitioners will utilize the VMA. We have some that do it on every patient. We have some that, do it on a case-by-case basis.
That's fantastic. I know, Nick, you and I came across this technology when we were both together in an orthopedic group. It got us excited. For the docs out there that are listening, watching, this is their first time hearing about it, I'd love it if you just would trace it back to where did this technology start? How was it originally utilized? And maybe from your point of view, what got us excited about bringing this to conservative care providers?
The technology was actually founded in the orthopedic and neurosurgical space. And that's where we were first introduced into it, really to determine the difference between, hey, do I need to do a decompression surgery, right? Essentially a surgery that relieves compression off of the disc, and not a decompression as we know it as chiropractors, but a decompression that is a surgery that doesn't use hardware. Or do I need to do a fusion, right? Put in rods and screws and things like that. So that's where the technology was founded, in the orthopedic and neurosurgery space. It's got about 10 years worth of literature that goes through the specificity, accuracy, and reliability of the data that comes out of this study. And so that's where it was founded upon. And when we first looked at it and I was first introduced into it, there was a whole realm of possibilities that the surgical aspect really only touches a portion of it. So from our standpoint, looking at it, certainly from understanding decompression to fusion surgery is great. But from the motion analysis and certainly from the functional side of the imaging component, we saw a world of opportunity with the conservative care providers because, as we all know, right, patients come into our offices that might have, an X-ray or an MRI that has minimal findings, but they're still in pain. They're having shooting pains when they're, walking around and when they're moving. But when they sit or they lie down, that pain goes away. Well, without the VMA, the MRIs and the X-rays aren't picking up that instability that might be encroaching on the facet or one of those nerves that causes the patient pain. So that's one of the things that we looked at and really saw a great opportunity for providers to utilize for the patient's benefit. Right now we have the answers to those questions that they're asking of, Doc, why do I hurt when I start to move around, but my imaging has come back, fairly clean. Now we have an opportunity to discuss, and more importantly, now the providers have a clinical direction as far as, wow, this is what the data is showing, and here's the next course of action for us from a treatment side. So
that's fascinating. Nick, can you get into the economics of it all? Is this a low-cost type of analysis that can be used to show people so that they understand the need for chiropractic care, or is this more of a high-cost type of a procedure that really is limited to insurance reimbursement or personal injury, or how do the economics of this work? Do patients pay? Do insurance companies pay? Well, how should doctors think about integrating this into their care plans?
Yeah, absolutely. That's a great question there, Jason. And really from our standpoint, it lies right on par with what an MRI would be, right? And so insurances are paying for this. We have a lot of auto accident patients that come in, but we also have a lot of major medical as well. So I would think of it as similar on the cost perspective of what an MRI would be for your patients, and a lot of times that's what we say as well for those providers that are asking, hey, when is the best time for me to order this particular scan? Right about that time in which you have the data that's collected on your particular patient, and you might be ordering out for an MRI, or you may have already had an MRI and you have some information. That's going to be the best time for us to order on the VMA, the vertebral motion analysis there.
That makes sense, and I'd love for you to just get super brass tacks on this, Nick. Differences between X-ray, VMA, and MRI. The docs out there listening, super familiar with X-ray, super familiar with MRI. I know you and I speak to docs every day, all day, and VMA is a new concept to them. If they're listening or watching and they're not able to visually see it right now, what's the difference between a proper X-ray, a VMA, and a traditional MRI?
Yeah, absolutely. So what we talk about is that the VMA is complementary and not competitive over an X-ray and MRI. Right. And so what we mean by that is it's not going to negate any findings or replace anything that you're going to have from an X-ray or an MRI. We typically, as everybody knows, the X-ray is going to show all of your bony material. Right. You're going to see your fractures. You're going to see anything that might be going on from the bone side of things. The MRI, really a lot of your disc material, right? Herniated disc, things like that. Those tissues are going to be shown on the MRI, as we all know and love it. The X-ray is really going to show the ligaments and the vertebral bodies. We measure three things with the VMA. We measure translation, angulation, and disc height. So within that, the VMA is really showing all of that translation that takes place, the angulation, so how those vertebral bodies sit on top of each other, and the disc heights. So again, as you can imagine, we used to practice with some providers that said, hey, you can have fleas and lice, right? You can have a bulge disc and you can also have, a fracture. Those things are entirely independent of each other. And so that's what we talk about as well, of your instability is really not going to negate any findings that you may have on an MRI or certainly from the X-ray standpoint, but it's additional data that is driving that clinical decision-making for providers there as well. So more information for providers to make the best decision on that.
Nick, I'm just curious if you can get, more specific in terms of, what are some of the common findings that you find, and what's the benefit of those findings? Is this for doctors to provide, more accurate, better, safer care? Is it for court cases to document and make sure there really is an issue that couldn't be found on, X-ray or MRI? Is it for patients to recognize, wow, I see my problem now, I should stay with this? What are the most common things you're finding, and what are the most common benefits from finding them?
Some of the most common things that we see is really going to be that clinically significant instability. And more often than not, that comes through from a personal injury case. The majority of the work that we utilize is, auto accidents, right? And typically when patients have an auto accident, they've got some sort of traumatic event. And, a lot of times it's, neck or low back. We only work on cervical or lumbar. But a lot of the findings that we will show are going to be that translation. So we provide the data for the clinicians. We don't necessarily provide, hey, here's a bulge disc, or hey, this is an unstable spine. We utilize that data. For example, they might have 2.5 millimeters of translation in the cervical area at a particular level. Well, to us, what that is going to indicate is that, okay, there is some nerve compression that might be taking place. And so that is a point of emphasis for us, and certainly something that the provider would take a deeper look at. And so we see a lot from the translation side of things, of how those bones are moving within that particular vertebral body. That's probably the most common thing that we find. And that's going to be with your auto accident patients. And a lot of times what happens is, you're going to have that particular patient that has had the MRI, they've had their X-ray, it does come back, relatively clean. They might have a bulge, but not a herniation, but their symptoms just aren't aligning with what the current diagnostic testing is showing. So that's where a provider's going to order that VMA. And that's where we're going to see, more often than not, that clinically significant instability is causing that nerve compression, which is causing the radiating pains. So it's not necessarily a specific diagnosis that we look at. We do provide that data, which allows us to be entirely objective from our side, and certainly helps out the providers as well because of the objectivity in that scan. And it's not reliant upon, a subjective finding, if you will. That data is true and reliable for providers to make the best clinical decision based off of those findings.
Yeah, that data is powerful, because one of the things that stood me up straight when I heard the stat was 30% false negative rate on flexion extension X-rays. And to think about 30% of the patients that you're seeing on a day in and day out basis, if you're shooting FlexX, you might be missing those findings between neutral, full flexion, and extension. And being able to gather that information has been incredibly powerful, and we've seen it through the practices that we've been involved with. As we wrap up today, for those docs listening and watching that would love to learn more about AOMSI Diagnostics and vertebral motion analysis, Nick, where would you direct them?
Yeah, the best place is our website. You can go to our website, www.aomsdiagnostics.com. In there, you'll see all sorts of information as far as on the clinical side of things, how to order it for patients, and also, some more information about us as well. We have some different models in which we can actually bring the technology to your office, make it as easy as possible on the patients there. And again, you'll be able to see all of those literature articles. You'll actually be able to see some of the motion studies as well on our website. So the best way to reach us and get some more information is www.aomsdiagnostics.com.
Sweet. I will be sure to drop that link below. Thanks so much for coming on today and chatting, Nick. I know there are so many docs out there that have shot X-rays in the past. Maybe they've ordered some MRIs on the occasion, but having something complimentary that shows the spine in motion while weight bearing can definitely be a powerful addition. And docs, I'm going to encourage you, if you're interested in learning more, click that link down below, aomsdiagnostics.com. And Nick, thanks again for coming on and chatting with us today.
Yeah, thanks, guys.
Thank you so much for watching this video on the Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.